Okay, so last appointment, we did a few assessments on you, and now we're just going to go over the results that we found, okay? So here on the screen, we have what healthy teeth and mouth looks like. So if you can see, the gums are nice and pink, they're nice and stippled, no inflammation. So this is what an ideal healthy mouth would look like, okay?
Yeah.
Okay, so this next slide here is your plaque or biofilm. So basically that's just bacteria that gathers along the gum line and in between the teeth. And when we were doing your deposit assessment, we found moderate generalized interproximal biofilm. Everybody has it. It can just be maintained through regular oral hygiene, so brushing your teeth on a regular basis. Then we have calculus and tartar. So it forms in layers, so there's slight, moderate, and heavy, and it cannot be removed by brushing. So it's good that you come to see a dental hygienist every 6 months for cleaning, so we can keep on top of that. Gingivitis, so that is red swollen gums that can easily bleed. You have 48% bleeding sites, which is a big amount of your mouth. However, it is reversible. So with proper brushing, flossing, all that stuff, we can reverse that.
Okay.
Then we have recession, so that's gum loss around the tooth. You did have recession as well, and it can range from mild to severe. And this could also be a reason why you have sensitivity to your bottom teeth as well, okay? Okay, so periodontal disease. So stage 1 just means you have 1 to 2 millimeters of clinical attachment loss, so that's recession. And you're automatically grade C because you smoke above 10 cigarettes a day. However, as this isn't reversible, it's manageable. So with proper oral hygiene, we are able to keep it at a stage 1 grade C without it progressing to stage 2 or 3, okay?
Sure.
And then periodontal debridement. So pretty much this is just us removing calculus from your teeth. So there's scaling. It is not scary, I promise.
Scale?
It just helps clean the teeth and remove deposits from below the gum line. So that is really good in making sure that your gums can heal. And there's also root planing, so that just smooths the surface of the gums. So this is just all good for your overall gum health, and it'll help heal your gums, okay?
Okay, based on your assessment that we had in the first appointment, we noticed that things that we need to discuss. Okay, so we noticed that you are high in carbs. You drink lots of energy drinks and sodas throughout the day.
Yep.
Okay, so do you think it would be possible to cut down on sugary drinks?
Nope.
Okay.
Absolutely not.
Okay, so what I'm going to recommend is that you drink those drinks with water. Okay, like in between, so you have a sip of your energy drink and then you have a sip of water. Or you can drink it when you're eating food. Okay, so you can have that. Do you think that's something that you would be able to try?
I can work on it.
Okay. I'm not really going to bore you with a lot of the details about Canada's food guide because there is a lot to know. So I'll give you a pamphlet at the end of the appointment.
Sure.
Okay, so during your assessment phase, we also found 5 spots of recurrent decay. And you said that you talked to your dentist about it, right? Right. So we want to tell you how it happens. It's because, like we said, it's from the sugar that you have in the foods that you eat. And this causes, in this mix with your bacteria, it can cause an acid. And we call that an acid attack.
Whoa.
So the reason why I'm recommending you drink water in between is so that we stop that. Okay? So another thing that can happen is, since you have recession, you have this root decay that can happen. Your cavity can grow bigger and migrate down to your root, which is serious because your root is a different texture. Okay, so it's easier for root decay to get in there. Okay, so these are the 2 types of fillings that we usually see. This one's amalgam and this one's composite. We usually we don't really see amalgam. It's kind of like the older ones, and the composite is normally the newer ones, right?
I have that one.
Right, yeah, you have composite.
Yeah.
So yeah. So tobacco and its effects on the oral health, it can increase the risk of oral cancer, gum disease, dry mouth, and changes like the bacteria that we talked about in the mouth that's happening, okay? So I noticed that you are not really willing to quit, right?
Nope.
Right, so we can try other things to help make your mouth healthy.
Sure.
Okay, so this is oral cancer. We usually see this in patients who smoke, which is so you have a higher risk. And the symptoms that we can see is like difficulty chewing or swallowing, lumps or thickening in the mouth, bad breath, white or red patches that don't go away. Okay.
Okay.
So this is dentures. Okay. We noticed. Remember how your tooth right here? See this? How it's gone? This is the tooth that's gone, and because it's gone, it can cause different things. So like, see this tooth, how it's out, right? And these are caving in, so that can happen to your tooth. Yeah. So we want to find solutions to fix that, so it doesn't affect your oral health. So dentures is a way to fix that. Okay.
So another option for your missing tooth would be an implant. So basically it's a metal screw that's inserted into your jawbone. And after a few months, once it's all healed, we're gonna attach a crown with the screw. I find it's a really good option because if you don't do anything for those spaces, you see how the tooth that's on top of it is gonna start coming out because there's nothing that's like occluding with the tooth.
Yeah.
And you're also gonna get more bone resorption on the area where the tooth is missing because there's no pressure being put there. So the tooth is just gonna, the bone is just gonna reabsorb.
Mm-hmm.
You also mentioned that you have some sensitivity. So basically that's just when you have a thin coating of enamel and you have visible root surface. So some things that will help with that is fluoride. So we have our in-office fluoride and we also have at-home fluoride. So what we do at our office is fluoride varnish, where we're just painting it on your teeth. It's gonna help remineralize your teeth. It's gonna help with sensitivity and caries prevention. There's also fluoride trays. At home, there's fluoride everywhere. You can find it in water, in different mouth rinses and toothpaste. Just make sure to read the ingredients on the back and try and find one that's stannous fluoride. That's the best type of fluoride to use. It helps with gingivitis. It helps with remineralization. And it's overall just the best fluoride product.
Mm-hmm.
You also have some dental stains. So basically that's discoloration to the teeth. And there's different causes, right? It can be genetic. It can be caused by, smoking. You can get it from coffee, wine, and tea. When you come in for your cleaning appointments, we're gonna polish your teeth to mechanically remove the stain. You can also do whitening with us as well, or you can do that on your own time with whitening strips.
Okay.
And I just want to show you this toothbrushing method since you do have a bit recession. This is called our Stillman's. So basically what you're going to do is you're putting your toothbrush on a 45-degree angle, and it's going to be a bit on the gums, and you're going to vibrate, and then you're going to roll and flick. And you're going to overlap with each other and just vibrate, roll, and flick.
Mm-hmm.
Okay. Do you like that toothbrushing method?
No, I hate it.
Okay. Well, we also have an electric toothbrush. I feel like based on what you told us, how much you brush a day, this would be a better option for you. It's electric, so it's going to move by itself. This is an Oral-B one. It has a circular head. So you're just putting it on the tooth at a 90-degree angle, and you're just going to let it sit there for 3 seconds for each tooth, and you're just going to move to the next tooth. Do you think that would be good for you to try?
Yeah, I would love that.
Okay, perfect.
Okay, so I'm going to be introducing the spool flossing technique.
Okay.
So basically what that technique is you just grab your floss here, and you're going to put it on your middle finger a little bit, and on the other side a lot. And then what you're going to do is seesaw back and forth, and then create that C shape and go up and down, and then seesaw back. Okay? Have you done this before?
Yeah, I hate it.
You don't like it? Okay.
No.
Okay. So then I'm gonna talk to you about some alternatives for that.
Okay.
So right here is we have like a spooling like device, and what you want to do too with this is put it in seesaw and then kind of create that C shape. You're not going to be able to do it that much since there's not a lot of movement.
Yeah.
But that's what you're gonna do. You wanna demonstrate?
Sure. So you're gonna seesaw it in.
Yes, seesaw it in,
And
light.
then you're gonna go in the sea.
Yeah.
And then in the sea.
Yeah, that is
Yeah,
perfect.
I like that way better.
Yeah, it's easier, and you can also do it when you're at your desk playing video games. Just kind of
okay.
just do it.
Yeah.
Whenever. It doesn't have to be at a certain time. It can just be whenever you're available. And then also too, this is another interdental cleaning for your like the larger spaces in between your teeth. So this you can just put here and then back and forth, and then you also want to repeat that on the other side too, just like that. Okay? Do you want to give it a whirl?
What you said is when there's space, you just shove it right in there.
Yeah.
And then you do it on the other side.
Yes.
Like that.
Perfect. And you want to make sure that you don't use this in tight spaces.
Okay.
Only more like loosened spaces, because we don't want to damage any of your gums.
Mm-hmm.
Okay. And this is like a toothpick basically. So you can use that interdentally, kind of like with this one if you're at your desk, and it's just another way to get to disrupt that bacteria in your mouth.
Okay.
So that could be also another device that you use just to disrupt that bacteria throughout the day. Okay, so this is a water flosser. It is another interdental cleaning, and what you're going to want to do with this is just go around the gum line, just like what I'm doing here, just around, and on the other side too, just around, just to, like I said, disrupt that bacteria. You want to demonstrate?
So you're just gonna follow the gum line?
Yeah, pretty much.
Like that.
Yeah. So
Sweet.
all these tools that I showed you are like interdental cleanings, and we can start implementing them into your daily routine, and we can choose the ones that you prefer.
Sure.
Okay, and this is a rubber tip. And this is a rubber tip stimulator. So basically, you just like with your water floss, you're gonna go around here like that.
Yep.
And then also you can go in between and just do circular motions, and this is gonna help with the blood flow. And since you do smoke, it's gonna help with that blood flow of your gums, and it's gonna stimulate your gums. So that's a really good tool for you, and also disrupting the plaque. We also have right here is a tongue cleaner. Have you ever heard of this one?
Yeah.
Yeah, you have? Okay. So as you see, there's bristles, and then there's like a kind of like a pattern. You can use either or, depending, but basically what you want to do is go at the back and then come forward and then lift up. You don't want to go back and forth, because then all the bacteria can be in the back of your throat. We don't want that.
Okay.
So just come forward, lift up, rinse, and then just repeat. Okay?
Yeah.
You want to try?
Sure. So only go forward from the back.
Yes. And scraping it all the way, and then just running it underwater in between.
I see.
Yeah. Okay, so I'm going to be introducing the spooling floss method. Have you ever heard of this technique?
Nope.
You're so close.
I can work on it.
Okay, that's good. Thank you. Wait, what did I say? Thank